Hello, how are you? Today I want to show you a case I am preparing for a treatment simulation. It is a very exemplary case in some things, and I want to tell you a little bit about it. With just the frontal photograph, we can already see some details of this case that I am going to show you. In our photographs we see a symmetry, an edging of the plane, and when we see the smile, that is, when we see the photograph with the lips relaxed, we see an increased incisor exposure, as well as a lip incompetence, a clear gingival smile as well. In profile, this patient is a patient with a receding chin, with the facial incompetence that I had shown you earlier. In the specific smile photograph, we also see that there is a more or less straight incisor emergence that I wouldn't like to modify during treatment. And we also see the labial competition, and we see the increased incisor exposure that you have as a result of the gingival smile as well. We have an average periodontal biotype. It is not wonderful, but we have better biotype than most of the cases. And this is where it gets interesting. These are your models in Miki, where one could think about retrusive. The teeth are already in a good class 2. We see that there is space in the anterior sector, so with retrusive one could get a certain characteristic. In any case, we can see that there is a crossbite on the right side, and that would be a matter of expanding and improving this. And this is where our type of diagnosis gets interesting, because this is what actually happens when the condyles are actually seated. We go from this position of maximum intercuspidation to this working position of the condyles in an orthopedic position. So already this kind of cases, isn't it? It is already difficult to solve a 13 millimeter overjet, isn't it? So we go from a 7 millimeter overjet to a 13 millimeter overjet of 13 millimeters. And this is where you say, well, will this kind of position or this instability affect the patient? Let's take a look at it. This is the same case of our patient, where we see that our teeth are in MIC. Here we have our 7 millimeter overjet, our anterior teeth in the position they are in, anterior teeth in the position that they are in. And here we see how our condyles are. So that's good. You can see, can't you, that the condyle is in a little bit of a distracted position just by looking at it in this picture. And now if we take this case to centric relation, we're going to see how the condyle is going to be centered with respect to the fossa. It is in this position where I want to start my treatment, and of course the overjet of my case increases. Let's look at it again. And we will see, won't we, how there is that condylar distraction from one movement to the other. In the other condyle, something similar happens. This is the position in which the MIC is, and this is the position in which it is in RC. MIC and RC. Isn't that right? We want a centered position of the condyle so that we can begin our treatment. This makes the case an obvious orthosurgical solution. For that, isn't it? Dr. Cristobal Quevedo has helped me to prepare just the surgery simulation. How are we facing this type of simulations nowadays? Thanks to the joint work, what we do is plan the surgery, of course, taking into account the factors of the face in order to solve the problem. And once we have the surgery done, we will be able to see how the teeth look, how feasible they are to decide their pre-surgical movement from the orthodontic point of view. So, now from this position of centric relation with an overjet of 13 millimeters, what we want is to be able to have this type of intermaxillary relation. Here, isn't it? The teeth overlap each other, and it is in this position that I am now going to generate the treatment simulation. This gives me a position in which, having ordered and having solved the transverse, vertical, and sagittal problems, in this case, in this position, I know that I am going to have occlusal stability at the time of surgery. So this is where I want to generate my treatment simulation. treatment simulation. If you want to see more of this case and see how the simulation is done, leave me a message in the link and I can tell you more about it.